Sure, it's 12:15. I show that it's 12:15 now. Welcome. I'm Sue Cox. I'm a member of UMEC, and I'm going to be kind of moderating this session, getting the UnMatched student up to escape velocity to the match. One of my favorite topics. I used to hate when I was the clerkship director, match day or match week, when on Monday you found out, oh, by the way, one year at Southwestern, I had 33 students apply to Ob-Gyn. I called the student affairs dean and I said, what's happening? I mean, what's happening? Did we have a good match? She said it was a bloodbath. And I said, oh no, for the school? And she said, yeah, but because of you. I had 11 unmatched students I had to scramble for back in those days before SOAP. So I'm looking forward to this talk. I'm going to turn it over to Naj, and he's going to introduce his team, and I'll turn it over to y'all. Thank you.
Thank you so much, Dr. Cox. So I'm Naj Gabor. I'm a OB-GYN program director at Hofstra Northwell, which is in Long Island, New York. Joining me today is Dr. Dee Katz. We're all program directors, program director at Lenox Hill, which is also part of the Northwell system. It's a system of about 22 hospitals. And Frida Nenton, who is also from New York at the Icahn School of Medicine at Mount Sinai, a program director as well. Adi, can you go to the next slide? Okay, whoops.
I can jump around, apparently.
Yeah, so we have nothing to disclose, you know, and obviously we're not experts in the match. We don't run the match. We're not on the board of directors, but we are committed to helping students apply smartly and matching. And I think you'll find it interesting that each of us have different viewpoints on this subject, which will be brought up during the talk. And I think we have a small enough group that there will be certain points during this talk that we'll pause a little bit and have a little bit of discussion or pose a question, or if there's something that was unclear. But we do have to keep on time, and we will end within the hour. Our first presenter is Dr. Katz.
Thank you, Dr. Gabor. So I'm just going to go over the numbers, the statistics. So there are 279 programs in 2021 and 1,460 positions. Of those, about 1,100 were taken by US seniors. And the second most common was DO match, which was 225. Overall, 1,457 positions were taken up by the match. So there was only 3 positions that were unmatched in 2021. So there were 204 US seniors who didn't match and 111 DOs that didn't match. But if you look at the numbers, it was 15% of US seniors didn't match and 33% of DOs didn't match into OB-GYN in 2021. When we compare the students who matched to the ones who didn't match, you can see that there were about the same number of applications placed, with about the same number of interviews offered, interviews attended, and programs ranked. For the MD grads, the DOs that didn't match had a little bit less interviews, so they were offered 10 interviews compared to 12 and ranked all 10 programs. And international graduates, there was a significant increase in the number of applications that they placed and the ones that didn't match, but about the same number of interviews. If you look at the number of applicants into ARADS over the last 6 years, you can see that there has been an increase in the number of DOs applying steadily, with a drop in 2020 and an increase in the number of MDs that were applying. But there has been a decrease in the number of international grads that have been applying. Overall, the numbers have increased over the past 6 years by 300 applicants. So the average student is also increasing the number of applications they're putting in. You can see that there's been an increase. For DOs, it was about 50 programs in 2017, up to about 90 programs in 22. For international grads, it was 57 up to 70. And for MDs, it was 52 up to 68. So overall, there's been about a 20 more applications per student over the last 6 years. It's been steadily increasing. So understandably, the number of applications each program is getting is also increasing. So we're seeing more DOs applying, more MDs applying to the programs, and less international grads applying. But overall, in 2017, we were getting 524 applicants. Now we're getting 665 per program. So that's almost an increase of 150 applications per program. So 2022, there are now 289 programs. If you remember, there were 270 last year, just 269. There's 7 military programs. There are now 1522 MD applicants, 506 DO applicants, about 600 international applicants. 49 programs are offering a preliminary position. There are 3 military programs offering a preliminary position, and there are now 1520 applications available. Spots, not applications, sorry. So this is data from the NRMP residency survey, program directors, that is done every year. And the number of program directors that answered was 89. So if you remember, there are 270 programs, 280 programs, 89 people filled out the survey. And this shows you that the mean applicants that they review was 652. About 300 of them were rejected based on their standardized screen. 375 were receiving a holistic review. They interviewed 91 applicants, and applications were sent. 81 were interviewed and 75 were ranked. So if you interviewed, you have a very good chance of being ranked. And this is the type of applicants that programs are sending interview applications for, interview invitations. So 92% of us are interviewing US MD seniors. About 47% are interviewing DO seniors. 30% are interviewing US MD grads. 18% US DO grads, and then the US international grads, 15, and non-US is about 7. So the most likely to interview is US MD seniors. And the percentage of programs using USMLE step 1, 2, and 3 as a screening. So about 40% of us are using the USMLE step 1 as a screening tool, less for step 2 CK, down to about 25%. USMLE CS, 42%, and step 3 is very low at about 6%. And a lot of us don't consider step 3 when we are looking at applicants. And for the international grads, it's again, most likely is step 1, about 40%, 30% for step 2 CK, 43% of us for step 2 CS, and only 9 for step 3. This is for the DO applicants. What we're looking at, again, step 1 and step 2, about 30%, step 2 CS, 40% of the time, step 3, very low at 8%. And then the complex USMLE level 1, 30%, and the complex level 2 CE and the complex level 2 PE at about 25-30%, and the complex USMLE level 3 only at 7%. So what percentage of programs are ranking candidate by type of candidate? 99% of us are ranking US MD seniors. 61% of us are ranking US DO seniors. US MD grads, it's down to 40%. US DO grads, about 25%. US internationals, 14%, and non-US international, about 5% of the time. So what characteristic in terms of education and academics are we considering most important? These are the program directors, what characteristic they consider most important. So it's the USMLE Step 1 score and the MSPF letter. And personal characteristic that are important to program directors is the letter of recommendations, the personal statements, and diversity characteristics of the applicant. So this is the characteristics that were considered in terms of education, academics, performance characteristics to rank the applicant. So most score was Step 1, the MSPE, and the USMLE Step 2 CK were the three most important in terms of ranking. And the personal characteristics were and other for the applicants were their interpersonal skills, their interactions with faculty during the interview, visa, and feedback from the current residents. So the interview does weigh heavily in the decision. So I'm going to stop here. I'm going to open it to any questions if anybody has before we move on to the next step.
Yeah, Dr. Cox has a question. With Step 1 going to pass fail, do you think there'll be a shift in emphasis to Step 2 CK?
I think we're very much number people, and when we get these many applications, we kind of have to have a way to separate them. They're all excellent and they're all outstanding. So I do think that we will shift to looking at Step 2 more than Step 1 currently.
Yeah, I agree with Dr. Katz. I think we are going to shift to looking at Step 2 because that's, I think, the natural thing to do or the most common thing that will happen. But given the fact that most students do well on Step 2 and may have done poorly on Step 1, they may have gotten, let's say 200 on Step 1, get their 240 on Step 2. I don't think it's that great of a discriminator. And what I envision doing, this is my thought process, what I envision doing is actually calling up people at that institution. So I may call up Dr. Cox and ask her, what do you think of, Sally, John, and Mary, and that I think will help me discriminate better. Because I say, I'm thinking about interviewing these 3 people, but I can only give 2 slots out, who do you think I should interview? And then, that kind of level of trust is what I rely upon many times when I'm talking to other people. Dr. Nenton, do you have any thoughts?
I mean, I agree. Unfortunately, you rely on the numbers because, yes, the average is 600 and something, but I had 950 something. And you just cannot realistically expect programs to do a 950 application holistic review. So you do need some kind of screening tool. And also, yes, they do better on Step 2 CK more than they do on Step 1. So yes, I think that Step 2 CK will become the new screening tool, but how good of a screening tool it'll be is, I think, going to be difficult to see when you do see that they do very, very well, like 230s, 240s, 250s on that test. So you do need some kind of something to help differentiate students, because the MSPs and the even the slows that were used this year, I don't think are very helpful in distinguishing some students from another sometimes. So,
yeah, I agree with that also. And I think if you look back at the numbers, the best chance a student has is the first chance. And if you look at the percentage of time that they're interviewed, it's only 39% of the time and ranked, sorry, 29% of the time they're interviewed. And of those people who are interviewed, only 39% of the time are they actually ranked. So the numbers drop precipitously once you have a student who hasn't matched. So it's really important that they try to match the first go around. Obviously, if there are more students applying than spots, then you have, there's an issue there, obviously. And hopefully some students who may be on the weaker side, whatever may make them weaker, hopefully it would be a way to convince them by showing them these numbers that they really should make their best shot. Maybe OB may not be for them.
So Raj, I like y'all's responses. I mean, I totally agree. We are so reliant on numbers. What do you think the shift will be with the introduction of the SLO, the single letter of evaluation? Will you rely more heavily on that if it comes from, program, rather than calling me? If I'd written a SLO, you would read the SLO.
I think
Right.
that's slow. Oh, sorry. Go ahead.
Go ahead. Well, I think the SLO, like Farida said, it was difficult to discriminate this year. I think it was the first year. I think the more experience we have, the better it'll become. I just think it seemed like every student that I got seemed to walk on water. So it's hard for me to discriminate. And you have to assume that the person writing the SLO will be truthful. Not that they're trying to lie, but obviously they're trying to do what's best for their student, that they're what's best in the student's interest, and that's matching. So they're going to try their best. And I don't blame anybody for anything like that, but it's just hard on the receiving end to discriminate. Farida?
No, I was going to say the same thing, that most of them were at intern level or near intern level. And, if every student if I have 17 applications from the same school and every single one of them are at intern level, it's a little hard to distinguish which one I'm going to interview. Do you interview the one that's a little bit lacking in medical knowledge as a end of third year student, or do you the one who's a little lacking in something else? So it's very hard when everybody's getting the same SLO, basically.
So we're going to continue on, Dr. Nenton's portion of the presentation.
So the aftermath and the beginning. So what do we do once the match has come and the student has gotten that unfortunate Monday notification that they haven't matched? So as their counselor or mentor, obviously approach this with sympathy, and it is the time to ask the student, what do they think happened? They're going to want somebody to blame. They may blame their letter writers, themselves, they're going to want to place blame. But now it's also time to hit the road running, and this is the time to put the pedal to the metal with, we're trying to escape velocity here, and it's time for a period of self-reflection. So let's do it. This is a time to do an autopsy of your application and interview process. So it's time. This is a good time to re-review the application. Were there any red flags in your application? Any poor grades? Any repeating of rotations? Any repeating of exams? How was your personal statement? Could it have been better? Was it generic? Where can we see improvements there? And obviously students don't have access to their letters, but as a mentor or advisor, it's a good idea to say, advise them to request new letters the next time without giving any information or specifics about their letters. And then if there are multiple students, or 33, like Dr. Cox was saying, students that interviewed, how many students applied? Did that hurt your students' chances? What's the reputation of your institution? How many programs did they apply to? How many interviews did they end up getting? How many programs did they put on their rank list? And then what institutions did they apply to? Did they have poor step 1 and step 2 scores and apply to Harvard and Yale, or did they apply to did they have more realistic goals? And did they maximize their chances by also including preliminary positions in their application process? And when they were receiving interviews, when did they receive them? Did they receive them in the initial go around when all of our programs are releasing them? Or did they receive them on a more rolling basis as people were dropping out? That can be also indicative. And how did they feel like their interviews were? Did they feel like they were, did they feel like they were doing well on them? What was their take back from their interview process? And how did they go about constructing their list? What was their thought process when they were making, placing their programs in their rank order? And then afterwards, what did they do after they left their interview? Did they send thank you letters? And this is where I think some of us differ. And what was the post-interview communication? Did they send emails? Did they receive any emails from the program? I personally tell the students, I am not going to respond to any. I welcome them, but I'm not going to respond and to not take offense. It's just so that they don't misinterpret any of my language. There's 2 other program directors on the call. They can maybe comment on this a little later, but this is another area to look at with your student. Next slide, Adi. So what is the plan? So there's areas that we just can't fix. You can't fix your step 1 and step 2 scores, unfortunately. You can't fix anything that you failed. You can't redo your clerkships. You can't redo your MSPE. You can make sure that you know what's in there as a student. You know, if you have had an interview and you didn't do well, and you can't fix what has happened in the past. You can't go back and fix any biases that that program, the residents or the faculty that you met have now formed towards you. So these are areas where they can't fix those. But what you can do is make a plan moving forward for what you're going to do in the next few coming months before you decide to reapply. So what are you going to do now? Are you going to, have you found a SOAP? Have you matched in the SOAP and you're doing a preliminary year in another specialty? And how can we maximize that opportunity? Are you going to be a prelim in medicine, peds, or surgery? You have to be the best intern in that program. It's a good time to reevaluate what letters you got. Maybe you develop better relationships as a 4th-year student on some of your sub-Is, and that's better to get some better letters. And if you are performing excellently in your prelim year, maybe it is a good idea to get some letters from your program. It is good to have some research. Are you going to do a research year? Then maybe it is a good place to demonstrate how industrious you can be in formulating a research question and publishing something. And it is also a good time to practice your interview performance if you think that this may be an area where you didn't shine. Because everything is virtual, you know, they have all these ring lights and how did your room setting look? Unfortunately, because it is how, you know, we do have to do this on a little, you know, I think this is a 1 by 1 inch square. These things do stand out, and you want to make sure that you are standing out and making an impression. And what was your essay about? What was the topic? Was it personalized to the program? And we can talk about that in a second. And I do think that it's important to address the elephant in the room. Why did you not match? Should be addressed in the personal statement. I do think that as a program director reading these, it does seem fishy or odd when it's not brought up in the personal statement. And it is a story of resilience and what was your process and what did you realize about the initial process and what steps have you taken to improve your chances this year, I do think should be addressed in a personal statement. I don't know if anybody else has any comments that they want to make at this time, but we can pause for any questions or comments.
You know, I have noticed a lot of medical schools are doing, I don't want to say sneaky, but maybe it goes under that heading, where they'll take their unmatched students and add in a research year. So it looks like they're still part of the medical school and haven't really graduated yet. And then they're graduation date is now the following year, 2022. I remember interviewing a few candidates this year, and I saw that they're on this 5-year medical program. I said to him flat out, "Did you not match?" You know, and the answer was yes. You know, so but then they put in this research year, which is supported the medical school. Then it looks like their actual graduation date wasn't 2021, it's 2022. But the reality is they didn't really match the first time around, and that's something that I've been on the lookout for, so to speak, when I was reviewing these applications. And I think the other thing you talked about, thank you letters, and I don't know what Dr. Katz does, but I don't encourage them at all. And like Dr. Nenton says, you know, if they want to send it, that's fine. It's not really going to change for me too much where we're going to rank them. And I don't respond to them at all. I don't do any post-match communication at all. I think that some students find that disconcerting, but I tell them up front, it's not because we don't like you, it's just because that's just the way we do it to keep things simple and clean. Letters of intent do actually make an impression on me. I have 10 residents per year. If I get a letter of intent and she's like number 11 or 12, I'm going to move her up because I'd rather have somebody who really wants to be in the program than somebody who may not be ranking as number 1. And I don't think there's a big difference between our number 10 rank and our number 12 rank, for example. So that, for me personally, that does make a difference.
I agree with that point. The thank you letters are very nice, but I again don't respond to them. But it is nice to see the letters of intent because it may make a difference for number, you know, we have 8 residents. It may make a difference for that number 12 candidate to move them up. It's not going to make a difference for number 50, but it will make a difference for people who are at the top, who are within a distance of matching. That kind of information may make a difference. So those letters I would encourage advisors to tell their students to send. But I would tell students not to be disconcerted if programs are not responding back to thank you letters.
Yeah, I've also have stopped responding to thank you emails, but I agree with like the letter of intent does help me kind of finalize my list for those top applicants who may not have been. I only have four spots. So if somebody was spot 6 and they really want to come here, I want people who want to be here. It makes my life easier. So it does make us reconsider the top spots.
Joe may have a comment or question. He came on.
Oh,
Joe?
yes. And I will also say that this year, we saw a lot of personalized personal statements about how much they wanted to come to our specific programs. I know I saw a very big handful. I'd never seen so many like that before. I didn't like it personally. I felt it to be disingenuous, and it did not make me give them an interview any more than if it had been a normal generic letter, personal statement, just because you're applying to 70 programs. That just to me says that you cut and paste from 70 different websites, which is nice to see that you can show effort, but it didn't mean to me that you actually want to come to my program. So that was my thought on it.
Joe, my friend, do you want to say something? Can you hear me, Joe?
We can't hear you, Joe.
No. Okay. No,
I don't. Yeah.
Yeah, we keep on moving because we do only have the hour. Okay, so once you do the autopsy and kind of, I guess, the bereavement process, so to speak, the student needs to definitely have a strategy because remember, their chances of getting an interview is low. It's only about 30%. And then their chance of being ranked is low. It's only about 40% if they get the interview. The key thing is getting the interview. Next slide. So this is some data that the WMC publishes. I think a lot of people look to this data. It is an N of 7,316 students. And what this basically shows, you can show the next slide. What this basically shows is that if your step one score, and again, step one as of, I think 3 days ago, is pass fail. So we'll show this table, but it may not be so meaningful in about a year or so. I think it's still maybe applicable to this upcoming season for starting in fall of 2022. The WMC data says if your score is above 234 on step one, you should put in about 18 applications with a confidence interval of 16 to 20, because it seems that after you put in more, according to their data, that it doesn't really improve your chances. And then, 217, 233, about 18, so it's the same. It doesn't improve your chances. It's almost the same. If it's 217 and above, it's almost the same number of applications and almost same percentage in terms of likely to match. But if it's less than 216, that's when I guess the bottom falls out, and they almost say double the number of applications. And that might get you to an 80% matching. And again, these are all averages based on 7,300 students. I think when you're dealing with an individual student, these group aggregate statistics may not always be reliable when you're talking about the individual, because this shows a tendency for large groups of people, but you're just talking about one student. It's really, you really need to individualize. Next slide. Keep going. Oh, so to me, and this is, again, this is our advice. People may disagree with this. And remember, this is about the unmatched student. So they're reapplying the second time. It's all about getting the interview. That's really, if you can't get the interview, then, that's it, you're done. So to me, you need to get the interview. Next slide. So my logic here is that if you have enough applications, then theoretically you get enough interviews. Remember, the chances of getting an interview is only about 29 to 30%. So I don't care what number of applications they put in the year before, they need to put in more applications, because those programs that did interview them may not want to interview them a second time, and you're starting from scratch. If they get enough interviews, and most of the data shows that if you have between like 11 and 20 interviews, average of 13 or 14, that you may actually match. So if they have enough interviews, then they'll have enough places to rank. If they have enough places to rank, again, the data shows most people rank between 11 to 13, then the student will match theoretically. And to me, when you're dealing with a student who's going around for the second time, it's a statistical numbers game. Next slide. And then, I tell the students also, I say, look, if you apply to 100 programs, which I don't really tell them, but I just give this as an example to them. If you apply to 100 programs to get one interview, it really tells you indirectly, A, you're not competitive, B, you're probably not going to match, and C, it might be time to apply to another specialty. It is an indirect gauge of your competitiveness out there. But on the flip side, if they apply to 100 programs to get 50 interviews, number one, it shows you're very competitive. Number two, it decreases their nervousness to a certain degree, but not to the point where they should be overconfident. And it does, reflect the chance that, yes, they will probably match. So, just by putting out a bunch of applications out there, it does tell you, it gives you a gauge as to how things may go, even before you start the interviews. Next slide. Another thing that can happen is sometimes there's reverse discrimination. Sometimes a student may have a very high step scores, and some programs will look at them and say, this student's never going to come to my program. Why should I waste an interview spot on them when I have other candidates who are more likely to, be in the interview, not cancel on us, and actually want to come to our program? So sometimes I've seen my very high scoring students get fewer interviews than those that might not have scored as high as them. And I think this is what may be going on out there. Next slide. So preliminary programs, I certainly encourage people reapplying to preliminary. I don't know why they don't do it. It's mystifying to me. I think it's some sort of stigmata, but I think you got to get your foot in the door. It gives you a year of credit. There are always spots that pop up on the career clearinghouse. I have 2 prelim spots myself, and I tell the 2 prelims, I say, look, I'm going to try to get you into a PGY2 spot. That's the goal. I can't tell you where they may pop up. You can't be really picky with geography. If it's in, Montana, well, they don't have programs in Montana, but if it's in Kansas, you go to Kansas. If it's in Texas, you go to Texas. In Florida, you go to Florida. That's where the spot may be. That's where you should apply and where you should go. You can't be geographically limited because it's not going to work out. The other thing that may happen if you're a prelim, sometimes I will offer our prelim residents, if the residents love them, they're doing a great job, I'll say, look, if you can't get a PGY2 spot, I'll be more than happy to keep you again as a categorical this time, and your residency will be 5 years instead of 4 years. But I think, in an average 40-year career, it's really not that big of a deal. I mean, it's a big deal to them at the time, but in the long run, I think they'll be happy that they did that. Next slide. And then, the student, again, who's applying a second time, or this can apply to a student who's applying the first time, but from your experience, you may perceive them as being very weak or unlikely to match an OB-GYN. They should have an alternate, like a secondary plan up front. And I've tried this before. Some students are very obstinate. They don't want to listen. But the few who do listen, I think, are grateful for the advice. To apply to a secondary residency, again, a realistic one, not neurosurgery, for example. It does increase the cost because more applications equals more cost. But, you have to ask them, would you rather match or not match? If they're like, it's OB or nothing, I don't care. I don't care if I don't match. It's got to do OB. Then, what else can I say to the student? But if they're like, I love OB, but I really would rather match than not be unmatched, and I'm okay with doing medicine or prelim medicine or surgery or pediatrics at this point. And if they get a lot of interviews in OB and they get a lot of interviews in medicine, for example, then they can always reject the interviews. So at least they're having 2 plans working at the same time. Next slide. The day before ERAS opens, next slide. Okay, they better, and I tell the students a million times, they better make sure everything's uploaded, including, you can't force people to write their letters of recommendation on time, but you can ask for them early and give the letter writer time to write it. Don't ask the letter writer with 1 week before ERAS opens to write the letter. Chances are they're not going to write it in time. Make sure you told NBME to upload your test scores, your essays up there, your applications up there. Schools will resend out the MSP on their own. Students don't do that, even if you're a reapplicant. And students have access, as we all know, to ERAS before the day things get downloaded, so they should be able to upload all that stuff before. Next slide. So this is like after ERAS opens, but before release of interviews. If you're talking about a student who's reapplying, I think sometimes a phone call to a trusted friend, or even if it's a cold call, I have called people. I say, look, Sally, she sent her, it has to be like the day after ERAS or the next day after that, it has to be very quick. Said, Sally applied to your program. I know she's not the strongest student, but I've seen her work, and I think she'll be great in your program. And I always add the fact that I'm going to interview her myself as well. So sometimes people will think, well, maybe they'll give the student an interview, but is it a real interview or a favor interview? Is it some sort of courtesy interview that they're doing as a favor to me because we're friends, or is the student going to get a real interview? And at the end, it may not matter, because if the student does really well in the interview and the residents like her and the faculty seems to like her. They may actually advocate for her. Does it give the student false hope? Perhaps, they may think they have a higher chance for matching, but again, it's all about getting the interview. How they do the interview is really on the student. Hopefully they'll practice, but it can only help, it can't hurt. Letters of interest, I think a student should always send that to, I see them and I look at them and sometimes their name sticks in my brain, and if I'm on the fence about interviewing a couple people and I have like 2 or 3 spots left, that might tip the scale to their favor. And what it should be in the email. Sometimes you can't put this in their essay, but why is somebody from Texas applying to New York? Why is somebody from California applying to New York where I'm at? So if it's helpful to know, oh, there are families nearby, they were born in that particular hospital I'm working at, there's some association with it, maybe they went there for high school, that kind of personal connection makes more sense that they're applying to my region versus just like cold applying. And that would also tip the scale towards me wanting to interview the student. Next slide. So after interviews are released, so last year, 2020, we had like 2 release dates. In 2021, we had 1 release date for those who followed the APGO recommendations. I imagine this year will probably be 1 release date. I'm not exactly sure yet. I'm not sure if they released it. But if there is 1 release date, they'll receive the vast majority of their interviews, that day or the next day. They may get a couple of interviews later in the season. I had a student who recently just got an interview just like 2 weeks ago at a place, and it seems she came off the waiting list. So she was not their number 1 choice initially, but somebody canceled late in the interview season and she was able to get the interview. Again, it's better to get the interview than not to get the interview, and hopefully she did well in the interview, but the vast majority are going to be that first day or second day. And again, if they applied to 100 programs and they only got 1 interview, then the prognosis is very, very poor. So 3 outcomes after the interviews are released. There are too many interviews. Again, I think if you have between 11 and 20, around 15, I think that's pretty good. Then you cancel some. We heard about hoarding of interviews this year. I'm not sure if they had 30 interviews, why they would hoard them. I'm not sure where the logic from the student came in. Maybe they wanted to go on 30 interviews or just waiting to see if they got better interviews, whatever better means. But the reality is, I usually tell the students around 15, between 15 and 20 are usually more than enough. Just the right number of interviews, and then too few interviews. That's the problem. Next slide. And we can go back to the slide for those people who matched or unmatched. They basically went on like 13 to 14 interviews and they ranked about 13 programs. Now these numbers are median numbers. So this is about around the 50th percentile. Some went to had more interviews and some had fewer interviews, but these are the median numbers. Next slide. Well, the real problem is if you have too few interviews, and it may be too late at that point, because like I said, most programs just can release all the interviews on the same date. And if you don't get any, you don't get any. And unless you have that parallel plan, you may be stuck. You could have people called for the student to get an interview. It's never really that helpful because already the student's not getting an interview on their merit. And the program is usually already released all their interview spots and they're already full. And again, somebody may interview the student if somebody cancels, but that's kind of that's very variable. Like you never know how many people are going to cancel. You could send letters of interest again. I did have like 3 or 4 cancellations, and some students did resend a letter of interest, and I did find that helpful because now I understood more of the motivation why they wanted to apply to our program. And those students I did give an interview to because they were on the bubble to me. They were on my wait list. And I don't really have a ranking order for the wait list. But those letters tipped them, let's say, higher up in the scale. And again, if they haven't done so already, they should apply to another specialty, like very quickly. And if they haven't applied to prelim positions, they should really do so already. You know, implicit in this is like the students really communicating with you. Some students don't do it. Again, I don't know why. We've all been through this process many, many times. They are novices in this process. Even if they've been through it once, they're still a novice, and they should really be upfront and honest with you all the time. And also keep the lines of communication open. Next slide. The interview itself, mock interviews beforehand, check the setup, ring light, quiet location, have good questions ready. I think the student should want to stand out. You should really ask good questions, not kind of the typical questions I hear all the time. You know, where do you see this program in 5 years? What are some wellness events? A lot of time these things are either answered in like the run up to the interview or in some material that the program may send out beforehand. One thing that always gets me is when a student asks me a question that's clearly on the website, like, we have fellowships. They may ask me, what fellowships do you have? And it's all over the website. I really don't understand why a student would not take the time to look, even just look at the website or the material we send out beforehand so that they're prepared for the interview. Next slide. We're calling this the secret interview. Some students may not realize that the pre-interview mixer is also part of the interview process. If they show poor behavior, lack of interest, or poor social skills during that Zoom thing, usually, the residents do remember. I remember when we had like, the in-person mixers the night before, usually at a local restaurant. A couple of students got drunk and just like fell over, and the residents obviously made a poor impression on them. And they were not pleased with that. So everything gets noticed by the residents. These are their future interns. These are the people who they feel they have to rely upon to a certain degree to do whatever work they need to do. A fourth-year chief resident always wants good junior residents below them. Next slide. And then after the interview, again, we talked about this before. If the program's okay with it, definitely send thank you notes. You got to express some interest. You got to keep the pedal to the metal, as Dr. Nenson said before. Next slide. And then after all the interviews, it's sometime in January, I would email the programs again, all of them, because usually they don't have that many interviews if they're reapplying. Expressing interest again. You should email one program as number one. You have to do it early. This year, the match list is due March 2nd, 9 p.m. Eastern Standard Time. Most programs do the list like early February, perhaps late January. So they need to really, send that number one email by the end of January. That's what I tell people. Again, I don't know exactly when every program does their rank list, but I feel like late January is a safe bet. And once a program, a student should not email every program as their number one. Yes, there are a lot of programs, but OB-GYN is a small community. And I remember I was the victim of that one time, a long time ago. And she ranked us, she said she was going to rank us number one. And we ranked her on the top, to match. And she didn't come to our program. And, she's kind of blackballed from our program in a sense. After that, she had wanted to work there as an attending, and I reminded the chairman of her poor behavior when she was a student. There's one exception, however, I think that exempts this rule. If a student emails a program that it's their number one choice, and if the program wishes to, if the student's not going to be ranked or is ranked last on their list, some programs will tell the student it may be a better idea for them to rank another program as number one because their chances of matching there are very minimal. Usually we don't say that second line, but I'll say to the student, I think it's better for your own personal interest to rank a different program number one, and they get the message. Next slide. And then, again, it's important how a student ranks a program. There are different ways students do it, how they feel for the program, some indication for the program, if they got an email from the program, the location, maybe they're geographically restricted, maybe there's some other thing that, maybe they rank all the university programs first and then the smaller community program second. Every student has like kind of a rationale. But I think it's important to help the student with the ranking and to rank programs, no matter what their location is, where you feel like they may have their best shot versus like ranking a place where they may not have a shot. Even if they had an interview, sometimes it's you could tell on lists which may be of a higher chance versus a lower chance. Next slide. And then so just a brief thing, they submit their application. If a program has a position open, if they've already interviewed there, then they can resend the letter of interest, because it's possible that the student maybe just missed getting matched there, and that program may say, hey, we interviewed Sally, we really liked her, she was number 18, but we didn't go that high, but maybe she would be good for our prelim spot. But again, on the flip side, if the student wasn't ranked at all, then the program may not even want to hear from the student and may not want to interview them or rank them again. And then, your secondary application, meaning that you're applying to a secondary specialty, may also play a role. If you've interviewed at some places and didn't match there either, it may also help you through SOAP. Next slide. I think this is our last slide. And then personal phone calls may help. I remember when I have 2 prelim spots, and a lot of times we are in SOAP because for whatever reason, students don't rank our prelim, the prelim spots. And I got a phone call from a large university. It was a cold phone call from the dean. And she said, I know the student, I've worked with her. She's a great student. Can you really look at her application? I think she'll be good for your prelim position. And I looked at it, the application is reasonable. I interviewed the student on the phone, she seemed reasonable. And we ranked her for SOAP, and she was with us, and I was glad. She was actually a very good prelim resident, and she was able to get a PGY2 position. So you never know, it's sometimes these random phone calls. You have to, you have to have trust. You have to trust that phone call, I don't know this dean, that she was telling me the correct stuff and not just trying to get her student matched at all costs. Next slide. Okay, so these are references. A lot of this data is on the NRMP website, HCG website, and WMC website. It's all open source data. The interesting thing is WMC continuously updates their data. So I had some older slides, which you may have seen in the app. I recently updated them because the WMC updated the data as to how many people applying in 2022. Next slide. So we'll stop. We'll stop here. We have about 10 minutes left. So I'm looking in the chat. So I think Sue wrote.
Question about how many PGY2 spots.
Yeah, I know there are about right now. I know there are 2 that are open for this coming July, and then earlier in the year there were some other PGY2 spots open, but that would have been more of a transfer resident who was already in a categorical spot because of the timing of it. But usually, unfortunately, after the match is when a lot of PGY2 spots open up, mainly because a lot of residency programs don't want to advertise that they have an open PGY2 spot because they know the medical students look at it and it looks bad for their program if they have a resident leaving and the student may not want to rank that program. It's a little political play there. Usually after the rank lists are due or after the match comes out, you see at least 5 to 10 more spots open up magically.
Great, thank y'all for the workshop. We really appreciate it. So you do list your preliminary spots in the match?
Yeah, I do. Yes, definitely. Okay. I always get them through SOAP, and SOAP last year there were so many good candidates. We ended up with really 2 great people, but it was so hard for me to choose. And the reason why I got these 2 people is because I know people at those programs, and I called them. One program called me, and the other program I called them, and everyone was truthful, and they're just 2 great residents actually.
That's fantastic. Other questions from anyone?
So again, I think there are a lot of ways to to do this. This seemed like the most logical way for us. It's really planning and strategizing and seeing the lay of the land. And, you know, you have to have an advisor who's willing to make some phone calls on your behalf and keep up with the student, you know, every step of the way.
With the virtual interviews now, have you seen an escalation in the number of calls you get from program directors that are,
No.
you know, want you to make sure that you saw their medical students' application?
To me, it's about the same number of phone calls or emails. I don't know about Adia or Farida, if you've gotten more.
I actually feel like last year I got a lot, and this year I didn't get as many. Maybe it's because everybody felt like they were in the same boat where we were all just drowning in applications. I don't know, but it didn't feel like this year I got too many.
Yeah, for me too. This year I got less special requests, as I call them, than last year.
Yeah, I am personally in favor of limiting applications for those people who are going around the first time around. I don't know if that's a good strategy for those who are going around the second time around. I think they're in a special category, and I wonder, I think first time around, I think if we limit applications, it may make it easier for all of us to do these holistic reviews. Now that step one is going pass fail. But I think if you're applying a second time, I think it's much harder, and perhaps allowing them to apply to more programs may be more in their best interest. But again, I haven't thought it through, and I'm not sure, you know, if having a two-tier system is a good way of going about things.
Okay, other questions or comments from anyone?
And WMC is having a seminar on February 16th about step one going pass fail from a program director's point of view, a medical school administrator, clerkship director point of view. So I think they're going to put out more advertisements soon about that. So if anybody's interested in going to that, it's in February 16th, but it's in the afternoon from 3 to 4 p.m. Eastern Standard Time.
Yeah, I guess we officially went to pass fail on Wednesday, right? The 28th, 26th?
You got it.
Yeah, I
Okay.
think it's just very challenging, I think, to do I mean, so many things are pass fail, right? Like their rotations are pass fail, like their grades are pass fail. So it's really, really difficult to pick out the students that you want to interview. It really is like finding a needle in a haystack sometimes. So good students are getting overlooked, but I think it's, you know, when you only have so many interviews to offer, it's very challenging.
Yeah, that's why I think I'm going to be making myself more phone calls outward to different people to see what they feel about their students. I currently do that with 2 programs. I've been doing that routinely with these 2 schools that usually send students our way, but I feel like I'm going to do it with many more programs this upcoming year.
Okay. Well, again, we want to thank y'all for submitting your abstract, being selected, and presenting the workshop.
Thank you so much, and thank you everybody for coming.